Hello, and welcome to Under the Orange Lights, a live webcast that connects the Orangetheory community with industry experts. I'm your host, Dr. Rachelle Reed, an exercise physiologist and your Director of Fitness Science here at Orangetheory Fitness. Today, I'm honored to be joined by Dr. Shannon Odell. She is a neuroscientist, a comedian, and a member of our medical advisory board here at OTF. So, Shannon, welcome and thank you so much for being here today. We are so excited to have you on. And Shannon, to get started, I would love to hear a little bit about how you became a neuroscientist.
Hi, I'm so happy to be here. Thank you, Rachel. I studied biology in undergrad, and I kind of started to fall in love with neuroscience. I was learning a little bit about neuroscience in my undergrad classes, and I thought, wow, I think this is something I could really get into. Um, so then I joined after college. I joined a lab and I studied, it was a neuroscience lab, and I found out I really loved neuroscience. So I wanted to really go into it. And then I joined a PhD program. And so I spent around 6 years studying
Wow.
neuroscience. Yeah, a while. Specifically, my dissertation looked at memory and epigenetics, but more widely, what my lab studied was how the brain adapts to meet environmental challenges. And, that ranged from early life stress to, chronic stress to drug use to also exercise. And specifically, we looked at animal models so we could really dig into the underlying mechanisms behind these things. And now I'm very happy to be a member of the medical advisory board here at OTF.
So tell us a little bit about what the Medical Advisory Board at OTF does for the brand and for the community.
Yeah. So, basically, we're there as an advisory board to any kind of scientific question that comes up, whether that be, safety protocols or, just this anything about the science of the exercise and continuing education and creating materials for both our coaches and our members of how exercise affects our bodies and the science of our exercises. And for me, how exercise affects the brain and
Yeah.
our mental health, because that's more of what I'm an expert in. So I'm excited to do this right now and chat about it.
Yeah, I mean, we're so excited to have you on and talk a little bit more about mental health and the connections between mental health and exercise. But what I wanted to start with was really talking about this science experiment that we're living in now. I mean, for so many people, COVID-19 has been maybe the first science experiment that they've lived through. And one of the beauties of science, but also one of the things that many people might have questions about, is the fact that science actually moves very slow. And I think that's a great thing. It allows us to be strategic as scientists and draw evidence based conclusions. So I wonder if you can expand upon that a little bit and also comment on what it's like to be a scientist right now, especially a science communicator like yourself.
Yeah, that's a great question. I think, yeah, this is such a difficult new time that we're all living in. And, one thing that I think this has forced us all to think a lot about is our own health, both physical and mental, and, how to take care of ourselves and how to remain, safe in this new environment, and the importance of looking for real experts, right? So we want to take advice from people who are, leading in the field, people who have spent, 6 years. I've spent 6 years. People have spent 40 years, 80 years. Yeah,
Yep.
well, 80 years would be a long time, studying these things. So really the importance of finding our sources, which is an important part of science, is figuring out what the right sources to find are, and like really vetted resources, find the right experts, and also being patient with the science, because not one study determines what the scientific consensus is. With science, you need lots and lots of evidence, and then we build conclusions. And those conclusions change because we're always challenging our conclusions, because that's part of science and that's how we move science forward. We don't just
Mm-hmm.
come up with one thing and say, okay, we're happy, it's done. We're
Yep.
always challenging, and we're always pushing the needle forward and collecting as much evidence as we can. And
Yeah, and I think that's such an important foundation to establish for our members who might be tuning in today as we dive into exercise and mental health because just as you mentioned, Shannon, COVID has really placed public health on a pedestal. And that includes, physical health. It also includes mental health, which is part of physical health. And so let's start there and talk about what mental health actually is. Like, if you were to define mental health, how would you define it?
Yeah, I think this is a great question because I think we sort of know in the abstract like what we think mental health is. But how do we put words to it? Sometimes it can almost feel like a feeling what mental health is. But
Yeah.
the World Health Organization kind of defines it as a state of well-being. And what it means is that you're able to work fruitfully, you're able to be productive, become a contributing member of society without having this overwhelming mental burden. So you're able to cope with stress, normal stresses, in a way that you can still, live a full, fruitful, happy life. Um, which is very important to think about because it's kind of a complex definition.
Yeah.
And I think we can sometimes water down the idea of mental health as being related to mental disorders.
Mm-hmm.
I think it also often gets confused. People would might think bad mental health is having a mental disorder, but that's just not the case. You can have me- great mental health and be living with a mental disorder, and likewise, not living with a mental disorder make does not automatically create great mental health, right? It's not one or the other. It's a complex thing. We simply want people to live fruitful, productive lives where they feel like they can contribute to their community without this overwhelming burden of mental stress.
Yeah, and with COVID and so many people experiencing large changes in their lifestyles, whether that's at work, at home, a combination of the two, I think there's been a lot of emphasis on mental health in the media. We saw the cover of Time magazine earlier throughout the pandemic was all about mental health. We've also heard from the World Health Organization that they're expecting prevalence numbers to increase over the next couple of months. So let's talk about prevalence, or the proportion of the population who has a specific characteristic, like over a specified amount of time. What is that looking like right now for mental disorders?
Yeah. So I think it's important to talk about right now, right? Because we have all these changes we're going through with the world, with the increase of the stress and the trauma that this pandemic has brought to so many people. Not to mention economic burdens, unemployment. There's so much to consider here, and you know, as a whole, mental health, the prevalence of mental disorders in the population is quite high. And I think it's important we talk about the prevalence of these numbers because, it's important to normalize talking about mental health,
Yes.
right? And it's important to take away the stigma around it. Because if you look at the prevalence, look at the numbers, it's something that's going to affect all of us at some point in our lives. It's going to touch our lives, whether it be ourselves or a loved one experiencing, a mental health disorder. So really interestingly, in 2017, say in the United States, it's estimated that 1 in 4 adults are living with or experiencing a mental health disorder, right?
Wow.
So that's
Okay.
a lot of
That's a lot.
people. Exactly. And that number is actually even thought to be higher in adolescence, that 13 to 18 year age range. And it's not just something that happens in the United States. It's estimated that 450 million people worldwide are living with a mental disorder currently. So that's 450 million people. That's a lot of people.
Yes. So
um,
many people.
so I think it's important in thinking about, okay, it's something we should be thinking about in terms of, creating policy and creating better lifestyles for everyone, but also to kind of destigmatize it. It's something that happens. It's normal. It's okay.
I love that you're saying that. And one of the things that I'm always reading about or hearing about in the scientific community is that prevalence of mental disorders is actually like hidden in the numbers. Can you
Yeah.
talk about what that means a little bit?
Sure, yeah. So I think there's a couple things, one thing is that like mental disorders don't have a look, right? You don't always wear it on your sleeve, and there's not an outward appearance. So there's no way of knowing that someone necessarily is living with mental disorder. But also, I think hidden in those numbers is, our ability as healthcare professionals really to treat mental disorders. Unfortunately, you know, treatment is not perfect, right? There's a
Yes.
lot of treatment resistant mental disorders. So that means that even though we have lots of treatment, it can be hard to address the symptoms, but also, not everyone has access to mental health services. And, we live in systems sometimes that just doesn't allow for us to get those resources. So it's something we think about a lot. If it's affecting so many people and we can't necessarily treat it. But I think also another thing is that this comorbidity. So the idea that if you are living with a mental health disorder, that you have an increased likelihood to have another mental health disorder.
Hmm.
So
Okay.
there's that's another thing that's sometimes hidden in the numbers. Um, so there's a lot to think about when we think about mental health.
Yeah, so it definitely sounds like it's a multifactorial issue, right? There are lots of different aspects of somebody's life that can influence their mental health. Can you comment on that? I often, with public health, talk about like zooming out your lens because that's really, what public health professionals and medical professionals and scientists have to do is, we usually have an area of expertise, but we also have to have the ability to zoom out and think about all the systems and layers that can impact somebody's health. Can you comment on that a little bit?
Sure. Yeah, I think, yeah, it's something always to think about because, I come from an animal lab. And so we have so many controls with our experiments, but we don't live in a controlled system. There's so much that affects our lives. When thinking about mental health or just health in general, or yeah, regular other types
All
of health,
health. Yeah.
all health, all health. Medical professionals, they look at factors that we might not think about necessarily. And it's really the environments that we live in,
Hmm.
whether that be the physical environments we live in, the economic environments we live in, and also, the social environments we live in, how they affect mental health. These are sometimes they're called the social determinants of
Yes.
mental health. And they're important to think about when creating policies and how to address mental health. And it's a bit intuitive to think about, okay, what could affect our mental health. It's so many factors. One thing may just be your age, right? We know, like I said before, adolescents have a higher prevalence of mental health disorders. There's also things such as economic inequality, that
Hmm.
stress of unemployment or financial stressors, that can affect your mental health. Or there's infrastructure. So, do you have access to green spaces? And we know access to green spaces is so important for your mental health. Are you affected by natural disasters, such as wildfires or hurricanes, and that can cause trauma and stress, or social and cultural, so important. Do you have a network of family and friends that you can reach out to? Not to mention systemic issues such as systemic racism, all things that could cause trauma. That goes so much goes into determining mental health that we have to think about as medical professionals.
And I think that's important for our members and for the Orange Theory community to recognize, right? That there are so many things that go into mental health. And that's part of like pulling back the stigma and really pulling away from that is understanding all of the things that influence it. So,
Yeah.
speaking of our Orange Theory members, I know a lot of them are wondering a little bit more about mental health and exercise because I think a lot of us at the surface level understand that exercise can be a really powerful health behavior for lots of different outcomes, including improved mental health. But a lot of us might not understand how that's actually working in the body. So, like, what's happening behind the scenes to cause these benefits in so many people. So, can you comment on that a little bit?
Yeah, sure. So yeah, I think exactly what you said. That kind of we all hear in the media and like intuitively that physical activity is linked to so many, positive health outcomes in general,
Hmm.
but also mental health outcomes. It may ease the symptoms of many, many mental disorders. And that's part of why the CDC recommends that adults get, at least that 150 minutes of moderate exercise or 75 minutes of vigorous exercise per week. And that's all those recommendations are based off of many, many, studies that have come to a
Yes.
consensus that exercise is great for our mental health. And what's really amazing about exercise and aerobic activity is that we see that even a single bout of aerobic activity, can reduce feelings of anxiety in adults. And but we see even, more results with that chronic everyday activity of that lessening of symptoms, to really help lessen that mental burden and achieving better mental health.
I think that makes so much sense. And that's something that we always want to highlight for our members is like every single workout, every time they show up, whether they're doing an Orange Theory at home workout, they're setting foot into the studio, or maybe they're even going for a walk with their loved
Yeah.
ones, they literally are positively impacting so many pieces of their health. And so I think that's a really, really cool takeaway. So let's talk about biological plausibility, or the in fancy science terms like what's actually happening. What are the mechanisms in the brain and the body that are helping exercise change us really from the inside out? Now, one of the things that we hear about is something called BDNF and neurogenesis. So I'm hoping you can talk about that and maybe even shed some light on why it's important that we study this in animal models
Yeah.
and how we can make inferences from that for humans.
Sure. Yeah. So a lot of this work on the kind of the mechanism. So we have all this, research from the CDC that shows that, in uh, randomized clinical trials, that if we have regular exercise, we can lessen these symptoms. But of course, as scientists, we're always saying, okay, but why? We want to poke
Yep.
around and figure out the mechanisms, especially if you're me, who's really a molecular neurobiologist, always wanting to know, but why? Um, so I am a little bit of a kid in that way. So my favorite thing to think about with exercise and mental health is this idea of BDNF, which is something that many people have probably heard of, but maybe not explained so well. So what is BDNF? It stands for brain-derived neurotrophic factor, but I like simple words. BDNF is good enough
Yes,
for
me too.
me. But sometimes it's even called miracle grow for the brain, which I think
Mm,
is such a fun visual to think about. More specifically, what BDNF does is it promotes the growth of new neurons in the brain. That's that neurogenesis.
okay.
But it also promotes the survival of neurons. Um, but it also helps with their branching and their connections with neighboring neurons. So you can think of the neurons in our brain as having these outgrowths, right? And
Mm-hmm.
the outgrowths are what connect the neurons to the other neurons so they can talk to each other. And
Okay.
a more connected brain, we think of generally as, a happier brain. Um, all of the neurons are happy, they can communicate to each other. What we have on these outgrowths are little bumps. And these little bumps are called spines. You might hear it, neuron spine density is
Yep.
sometimes thrown around. And it's literally just meaning how well our neurons can connect to each other. And so, what does this mean for mental health and exercise, right? So, in animal models, like I was talking about, we can see that after chronic stress, there's a decrease in spine density. So, a decrease in these bumps that kind of connect the neurons to each other. And what, interestingly enough, what we see is after regular exercise, we can actually reverse this. So we can see an
Mm,
increase in the spine density in these neurons. So these neurons, you can think of them as more connected. They can more easily talk to each other, which is really interesting. And how it does this is it's thought through this increased release of BDNF, that brain miracle grow.
okay.
Um, Also, what we see is increased neurogenesis. So there are very few areas of the brain that can actually create new neurons. One of those being the hippocampus. This is the area I studied, so it's a little bit of a favorite of mine. But the hippocampus is home to like memory, to
Yeah.
literally
Yep.
storing memories. So we see an increase in neurogenesis, which is associated with better memory skill. We actually see in young children they have lots of neurogenesis going on, so they're creating
Mm-hmm.
lots of new neurons. And as we get older, that slowly decreases. And that's thought to be the reason why, as we get older, we have a little bit more trouble with remembering everything. But what's great about exercise is that we're increasing this BDNF. So we may be increasing this number of new neurons that our brains are connecting.
That is so fascinating. I love understanding the mechanisms behind this. So, thank you for explaining that so
Yeah.
well. And now I know that you love the hippocampus. One of the things that I love and really get pretty nerdy about are psychological constructs. And I know another potential mechanism by which exercise can improve mental health is by improving self efficacy. So, to start, can you talk about what self efficacy is and then maybe why exercise can improve that in people?
Sure. So self-efficacy, it's normally defined as, it's situational specific self-confidence, right? It's this idea, it's one's belief in their own capability and something specific, such as exercise, right? You're doing
Hmm.
exercise, you're getting better at it, you're feeling confident in your
Yeah,
ability to get through an exercise or to go on a walk around the block and feel good that you can accomplish that. And the theory generally states that as one's depressive symptoms may decrease or become less severe as one's self-efficacy increases. So that's
okay.
another construct in which, so we have this biological construct and also this psychological construct here. And we have a lot of evidence for that. It just shows this kind of multifaceted
That's
area that,
super interesting.
so
Yeah,
it's hard to point to like what is the one thing that is improving your mental health with regular exercise, but it's probably all of these combined.
yeah, probably all of these things working together behind the scenes. And I think one idea that you mentioned earlier was with this multi-pronged approach, there are also other health behaviors that exercise can improve, which are also linked to mental health. So things like sleep quality and pain. Can you talk about those a little bit? Because again, it is probably a lot of these things working together behind the scenes.
Yeah, absolutely. And I think it's so important, just like we were talking about, when we're talking about mental health, we can never think about like, there's no one reason.
Right.
And there's so many things involved with creating a good mental health outcome. So we know that for things like sleep and pain management, you know, I we know that those who are living with mental disorders are more likely to experience a sleep disorder, right?
Mhm.
Or chronic pain. And that issues such as sleep disorders or chronic pain can certainly exacerbate mental health disorders, right? So we have to look
Yep.
at the whole approach. So, for instance, with sleep disorders, this is a risk factor for many mental health disorders. And also, we just know that 1 in 4 Americans are experiencing. So we see that exercise can improve sleep quantity. I mean quality. So by improving sleep quality, you may be able to improve your overall mental health. And the same thing with pain, right? So we know that living with chronic pain can be a risk factor for developing a mental health disorder. But we know that regular exercise can, in fact, reduce pain perception and it can actually be helpful in managing this chronic condition. So, by managing their pain, you might be improving your mental health. So, it's really, yeah, a multi pronged approach.
It really is. And I think one of the key things for our members to take away is that the dose of exercise we're talking about isn't some like super high, crazy number that's hard for them to achieve, right? It is, as you mentioned at the beginning, about 150 minutes per week of moderate intensity physical activity or about 75 minutes of vigorous. And they can get that by, taking 2 to 3 OTF classes per week, whether that's in a studio, an online workout, or whether even that's going for a walk or playing with your kids. So there are lots of ways that you can sort of build this into your weekly schedule. So I wonder with that, do you have key takeaways for our members as we wrap up today?
Yeah, sure. Something to think about, and just thinking about what I would want people to get out of this talk is that I think thinking back to that, 1 in 4 individuals at some point are experiencing a mental health disorder, right? And really kind of highlighting this fact that it's not a personal failure. It's okay. as they say, it's okay to not be okay. And,
Mhm.
reaching out to mental health care providers or just healthcare providers, if the burden is too much, there's nothing wrong with that. Exercise is definitely a tool that you want to have, but it doesn't replace the fact of, if the burden gets to be too much, you want to talk to those mental health professionals, and it's
Definitely.
okay to reach out. And yeah, it's at some point in our lives, we all um, may feel the effects.
Well, I think this has been so, so helpful, Shannon. Thank you so much for sharing your expertise. And thank you all for being part of Under the Orange Lights. This was our very first episode, and this is a live webcast dedicated to connecting the Orange Theory community with industry experts just like Shannon who are ready to answer all of your questions about fitness, health, and wellness. Make sure you follow our channel and even click subscribe so that you can receive notifications the next time we go live. Thank you all so much. And until next time, stay orange.